Kybella is liposuction in a needle, I like to call it. It is simply fantastic. Kybella is a injectable fat-melting drug that was FDA approved several years ago that I did the clinical trials for. It is used on label under the chin to melt fat under the chin. It takes somewhere between 4 to 8 treatment sessions. It is not overnight. I do call it liposuction in a needle because it is fabulous. You don't get the downtime you do with actual liposuction, and you do get fabulous, consistent results. Off-label, I use Kybella in the pre-axillary fat pad, that is right before the bra line. I use Kybella off-label in the stomach. I use Kybella off-label on the inner thighs and on the back. So these are some of the larger areas where we use Kybella in our clinical practice that also work very well. Each time you inject with Kybella, you can get a little swelling, you can get a little bruising, and you can get, just as tender. The Kybella is basically beating up and fighting the fat cells and blowing them up and treating them and starting the process of getting rid of them. People can swell for easily a week or two after each Kybella treatment. We do Kybella all year long. We do it in the summer, we do it in the winter, we do it in the spring, and we do it in the fall. When we do it in the summer, I tell people, ice up, walk out with your t-shirt on, and it is what it is. It'll look better shortly. And in the winter, people can try to hide and cover with turtlenecks a little bit, but it's the same thing, ice up, and it is what it is because they're getting a fat pocket treated. And especially with some of these stubborn fat pockets in areas that I just described, it would not be going away without the Kybella. In terms of other things that Kybella does, it can treat the jowls, and so that's become a very, very popular area. And again, it can swell up and bruise a little bit, but my patients are so happy and so content with what they look like that they're willing to keep doing it, keep moving forward, and they're delighted. I do have a lot of patients that come in the office that want more than one area treated at a time. Kybella comes via the vial, so we decide how much we're doing, and we go from there. I do give patients ice on their way out of the practice, and I schedule them for typically a 1-month follow-up. Like I said, it takes a minimum of 4, but typically up to 8 treatment sessions. It depends on how large an area you're treating. It is something that I have personally used on myself, on my own inner thighs that are 1 3/4 inches down. I look better in jeans, I look better in clothes, and I feel more confident. I run probably 25 miles a week, but yet I had some stubborn fat pockets that weren't going anywhere, and with the Kybella, I look and feel better. What I tell all of my cosmetic patients is this is a very age-defined world. No one wants to be the old guy or the old gal at the office anymore, and nobody wants to look poorly. So Kybella, fillers, Botox, non-invasive fat melting, sclerotherapy, those are some of the many different minimally invasive to non-invasive, it's a needle, treatment options that we recommend to our patients so they can look and feel their very best.